Good morning, everyone. We're going to be getting started right at 10 o'clock this morning. Thank you all for joining us for today's webinar. Good morning, everyone. I'm Rebecca Vickers, and on behalf of the Florida Alcohol and Drug Abuse Association, welcome to today's webinar entitled Preventing Strategies for Vaping Marijuana. This webinar is being made available through a collaboration of the Florida Department of Children and Families, Office of Substance Abuse and Mental Health, and the Florida Alcohol and Drug Abuse Association. Please note that as an attendee, you are in listen-only mode. If you have a question, please send them to the presenter by using the chat panel. The button to open the panel is usually located in the lower right side of your monitor. Please use the chat to send any questions you may have as you think of them. The presenter will address questions as time permits. Our audio is broadcast through the internet to your computer. If you experience poor computer audio, there are a few options to try on screen right now, and these options will be posted within the chat panel. If you continue to experience poor computer audio, try rejoining the webinar and use the I will call in telephone option. You must be connected to the audio of this presentation and view it on screen as well to receive a certificate of attendance. The recording and materials used in today's presentation will be available on FADA's website within 30 business days. To access the recording and PowerPoint, go to www.fada.org, then to our Resource Center, and then to our training library. FADA produces many webinar workshops in support of the Florida Department of Children and Families. To help participants track credits earned through attendance, we host an online community that provides a personalized digital journal where participants can maintain statements of credits for webinars and workshops taken through the Florida Alcohol and Drug Abuse Association. At the end of today's webinar, the web browser will direct everyone to an evaluation form on FADA's website. You will first need to register or sign into your account to complete the evaluation. Information you provide FADA as a part of registration remains confidential. Statements of credit will be posted 30 business days after the evaluation closes for persons completing the evaluation and attending the full webinar. Completing the evaluation is necessary to receive CE credits or to access your statement of credit. Please note that the evaluation will close midnight Monday, May 29th. Up to 2 continuing education credits are available for participating in today's webinar for persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, and Mental Health Counseling, and for persons credentialed through the Florida Certification Board. If you are a licensed healthcare practitioner, be sure to include your Florida license numbers for reporting to CE Broker when you registered for this webinar. If you are certified with the Florida Certification Board or licensed outside of the state of Florida, you do not need to provide your certification number when you register. Please note that WebEx monitors arrivals and departures of attendees and provides a report upon completion of the event. We are not permitted to provide a certificate of attendance if you do not attend the entire webinar, and we are not permitted to provide partial CE credit. And now I'd like to introduce today's presenter, Jake Levinson. He is the administrator of Prevention First Cannabis Policy Resource Center, working to assist municipalities, coalitions, and law enforcement in using cannabis policy as a prevention tool. Beginning in prevention in 2010, Jake's area of interest and expertise include prevention policy, planning and implementing youth prevention education, school-based communication campaigns, coordinating community coalitions, engaging stakeholders in community assessment and data analysis, and grants management. Jake, I will turn the presentation over to you.
Great. Thank you so much, Rebecca. I appreciate that wonderful introduction and just want to express my sincere appreciation for everyone who is joining us on the webinar this morning. And thank you to FADA for hosting. I just want to begin today by listing some of the objectives that we have for our webinar. We're going to spend a little bit of time just understanding what are the trends in youth vaping use. And you'll notice that it does say youth vaping use. The reason for that is that nicotine vaping and cannabis vaping, when it comes to prevention strategies, are still fairly intrinsically linked. So while today's focus is on preventing marijuana vaping or cannabis vaping, there will be a bit of information as well about nicotine vaping to help us understand the full context. We're going to spend some time looking at particular risk and protective factors of youth vaping, as well as some of the consequences or outcome of youth vaping use. And finally, we're going to spend a bit of time today identifying and describing some of those evidence-based strategies for preventing youth vaping. And again, I just wanted to make clear that while I was researching for this webinar, it was really strongly apparent to me that it's really difficult to separate cannabis vaping from nicotine vaping. So again, we'll be really discussing both in order to get that full context. You got my bio a little bit, but I just wanted to talk about our overall goal at the Cannabis Policy Resource Center, which is to really help communities increase their capacity to address youth cannabis use through policy implementation. We will talk today about how environmental strategies like policy change can help impact youth vaping use in particular, but we'll also present other types of strategies that should and can be done alongside environmental solutions like policy change. I know that today we'll be covering a lot of information. I will leave you with my email address, so please feel free after the webinar today to reach out with questions. We are available. And if I can't answer your question directly, I'll make sure that I work to ensure we send you somewhere where you can get that question answered. A little bit about my organization. I work for Prevention First. We're a statewide nonprofit in Illinois. And, I really appreciate being able to work with and present with out-of-state audiences like Florida. Really helps me better understand the national landscape of cannabis prevention. Our mission at Prevention First is to advance efforts to promote healthy behaviors and prevention of substance misuse in every community through a variety of evidence-based and collaborative approaches. And that includes our training programs, one-on-one support, and building public awareness. How that looks in action: we advise by working with organizations to actively promote healthy behaviors so that they can be effective in their missions. We amplify through our training and ongoing education programs to work with individuals who deliver prevention services so that they're best equipped and confident to support clients, schools, and communities. And we advocate actively addressing prevention areas of need through, again, public awareness campaigns, the resource centers, of which the Cannabis Policy Resource Center is one, additional special initiatives, conferencing, and networking events. And finally, a little bit more about the Cannabis Policy Resource Center. You can see our audiences and our services here listed on the slide. But also when you go to the Cannabis Policy Resource Center webpage at prevention.org, here's what you can expect. You'll find resources including print or electronic fact sheets and resource guides. You'll find archived and upcoming live webinars. And you'll find a place to sign up for our newsletter, where on a monthly basis, we are sharing both new resources, new research, new events. So please feel free to sign up for that. Pretty soon, we're launching an exciting project I'm really looking forward to, which will be a directory of municipal ordinances so that communities can best explore practices and how to use policy around cannabis as a prevention tool. And of course, I'd be remiss if I didn't identify that Illinois, unlike Florida, is an adult use cannabis state. So the range of policy will be very different in a non-adult use state. But again, we do know how quickly things can change in this arena. So it may be beneficial to understand the full landscape, what some other states are doing, in case you start to see things like that popping up in your own home state. Okay, thank you for your patience and your interest as we discuss a little bit about our agency and our program. I'm gonna go ahead and dive into our content this morning. Before I do that, I did want to just reiterate that you can feel free to pose questions in the chat. I will do my best to address those as we go throughout the webinar. I may take some particular times throughout to pause and answer those questions, just depending on how our flow is going. And to let you all know that at the top of the hour at 10 o'clock, just around then, we will break for about 5 minutes 2 hours is a long time for anyone to sit, and it's a long time for me to talk. So you can expect that, and I'll let you know when that is and when to come back. And then we will go till about 11 o'clock, and we probably will have some time to catch up and finish off any questions that we didn't get to throughout the webinar. I wanted to talk about some of my motivations for developing this webinar, why I think this topic is ripe for a lot of education, and why I chose a lot of the content in today's presentation. I think a lot of us are probably aware by now that vaping has become one of the most common methods for youth to use both nicotine and cannabis. And in fact, in some areas, it is the most common method of use for both. According to the American Heart Association, e-cigarettes were the most commonly used form of tobacco in 2019. And we'll talk later about why vaping in particular is a concerning method of use. But for now, I just wanted to convey that without interventions, this trend is likely to continue. And one of the biggest reasons for that is that youth have a lower perceived risk of harm of vaping compared to combustible cannabis or tobacco. This isn't surprising. Vaping is marketed this way, and there is honestly some evidence to suggest that when you directly compare the two, vaping can carry some lower health risks in some ways. But what I want to say is that a lower risk of harm is not no risk of harm. And that's the perception that we need to work on correcting. When vaping devices first hit the market, I think there was a lot of hope that it would be a wonderful tool for assisting folks in quitting combustible use. But what we have found instead is some evidence that youth might be more likely to engage in combustible use after they first use vaping devices. So that is a big public health concern, that we now have a generation of youth who may have otherwise never considered combustibles being more vulnerable to cannabis or nicotine use thanks to this novel route of initiation. And again, we do have some data that backs that up. The number of adolescents who've tried to quit e-cigarettes but weren't able to has grown in the past 5 years. And that's concerning because prior to that, we had a 2-decade-long decline among youth who tried to quit nicotine and were successful, and were not successful. So we were doing really great with having youth quit their use, and now vaping has seemed to intervene in that, what was until now a positive trend. And the other strong motivation is that it's not simply that nicotine and cannabis have significant harms. If youth are using simply what's known as vape juice or that vaping liquid, they're still being exposed to substances that can have unintended consequences. And according to some CDC research, there are vaping products out there that are marketed as containing none of these substances, but when they were tested, found to have both. So now we're also getting into a situation where youth are thinking they're using one product and in reality are getting delivered a dose of something else. You may have noticed that I tend to prefer the term cannabis to marijuana. So I just wanted to spend a little bit of time getting on the same page about that terminology. First of all, let's address vaping. That's a problematic term. I think it's one that makes it easier to sell the idea that vaping is less harmful or is beneficial, but it's not a wholly accurate term. What vapes do is produce aerosols, and those have a different composition than a vapor. So in an effort to correct this misperception, you may have heard some other terms like electronic nicotine delivery systems, or ENDS, but there's also clearly an issue there because vapes are used to deliver substances other than nicotine. And when we get to talking about cannabis or marijuana vaping, that confusion can be significantly increased. Cannabis use has always carried with it a lot of different lingo, and that hasn't changed. Some of the terms, though, can be particularly misleading. For example, while oil cartridge vapes tend to be the most common, dry leaf vapes are available, and they're often sold as something called heat not burn, which is kind of a marketing term saying that they're less likely to produce noxious chemicals because they don't reach a certain temperature. But what research has found is that many of these products allow for a great amount of user control of the temperature, which means that they're going to get into that range where leaf is burned if they want to. And we know that those higher temperatures are more likely to produce chemicals that may be harmful. And then now I want to address why you'll hear me refer to cannabis and not marijuana throughout this webinar, and on any CPRC products that you might find. You know, both terms do have different connotations, and there are valid reasons for using both, but my reason for using it in particular is that it's more broadly encompassing of all of the range of products and substances that people use. You know, ultimately, all marijuana or hemp-based products do derive from cannabis, unless they're synthetic, but there are products which, from a legal standpoint, aren't considered marijuana, that are being used to cause psychoactive effects and which cause negative health effects. And I think it would be leaving those out of the conversation in some ways if we use marijuana as a term exclusively. So I think it's important to identify both, what they both mean, and be cautious of what we're using and when and why. Because I am a policy person, I did want to provide a little bit of the regulatory context around vaping and how we got exactly where we are with the availability of vaping devices. So federal vaping specific regulation began in around 2016. This was, of course, several years after these devices first became available to purchase on the market. But even though regulation had started in 2016, to date, no single vaping device has received authorization from the FDA for their originally stated intent, which was assistance devices for tobacco cessation. And while the FDA does officially regulate them and has not, again, authorized for that particular use, obviously vaping devices are broadly available. What complicates this as well is the various landscapes of cannabis regulation across the country. So while if you're living in Florida, you might not be in an adult use state, there are still going to be many vaping products available in your state, potentially some of which are made from hemp-derived products and cause psychoactive effects similar to, you know, delta-9 THC, which we think of as marijuana. And these products are less robustly regulated at the federal level. And therefore, you know, their availability really is broader. You're going to find them in a wider range of places. You're going to find them in, you know, unlicensed locations. You're going to find them in retail shops. So while I might cover some things that on their face, they only seem to be related to adult use states like Illinois, again, I just want to encourage all states to consider the aspects of these policies that may apply to some of those cannabis derived products as well. I wanted to share this quote because I think it's a really good one to illustrate the concept that safer does not equate to safe. So this is from Mitch Zeller, who's the director of the FDA Center for Tobacco Products. And he said, when it comes to kids, the harm reduction question doesn't apply because kids should not be inhaling any of these products into their lungs. So from a prevention standpoint, there's really just not a lot of good reason to justify why any vaping product, whether it contains cannabis, nicotine, or neither, is available to youth and accessible to youth. Again, no current product has FDA authorization for the purpose of tobacco cessation. So it really is clear how, you know, the perception of vaping as healthier or even potentially a health tool is a significant contributing factor to all substance vaping use, especially among youth. Flavored products are another area where we've seen a lot of regulatory progress, but it's not perfect. And I wanted to spend some time on it because what currently exists can be a little bit confusing. I think there's a perception out there that recently the FDA went ahead and banned flavored vapes. That's actually not true. There's no national ban on flavors. Instead, what the FDA did in 2020 was reiterated or stated that no flavored products have authorization to be sold anywhere. And it's taken steps to address the manufacture and sale of these devices, including doing things like sending notices to manufacturers that they were out of compliance with regulation due to a lack of that authorization. But what's encouraging is that some localities have gone ahead and taken up this issue of flavored products and have gone ahead and implemented what are actual bans on the sale of vaping flavors or flavored vaping products. I think this is really important to understand because it's a great tool for helping communities get products removed from shelves if they're in violation of the authorization, but it also gives state and local areas additional leverage from a policy standpoint to enforce already existing regulatory schemes. And I just got a question. So was Juul a federal ban on flavor? Again, it's not a federal ban. It was just a statement that flavors weren't particularly authorized. So if there's a ban, it's going to be at your state level or at even municipality or potentially county level. Great question. We've gotten to the trends portion of our webinar today. I really wanted to help get an understanding of the extent of youth vaping and talk about some of the strong data sources that you yourself can use for your own prevention strategies. In Illinois, our state has its own tool called the Illinois Youth Survey, which is an every other year assessment of youth health behaviors, attitudes, and beliefs. But on the national level, there are very good tools, the most comparable of which are the Monitoring the Future study, which I'll use for the data trends today, since we're talking about some cross-state data, as well as the Center for Disease Control Youth Risk Behavior Surveillance System, or WIRE-BSS. Again, I'm going to present data from the Monitoring the Future study, but there are additional sources that you can turn to, such as the National Survey on Drug Use and Health. Again, there's a population assessment of tobacco and health, and the National Health and Nutrition Examination Survey will also give you solid data to work from. Monitoring the Future is conducted by the University of Michigan, and it does receive funding from the National Institute on Drug Abuse to do this continuing study. I do want to talk about the trends in youth nicotine vaping again, because nicotine and cannabis vaping, I think, are just really intrinsically linked. And if we understand what's gone on with the proliferation of nicotine vaping, it's going to help us understand why we got to where we are with cannabis vaping. This legal market for nicotine vaping devices has really created both significant availability and helped contribute to the demand in cannabis vaping as well. Before I dive into the numbers presented on this chart, what I wanted to convey was that in the 2 years prior to the data I'm going to present, youth vaping use between 2017 and 2019 doubled. According to the Monitoring the Future, again, that youth vaping use between those 2 years doubled, which I think is a historic measure, a historic data point for all youth substance use. So that's really important context, because even though now the trend looks like it's starting to level off or maybe even reduce in some areas, I think we have to be vigilant that we don't go back to a really exponential rise in this particular substance or particular method of use. So again, after that really super quick growth, rates have come back down a bit and seem to be holding steady.
For tomorrow.
Oh, really?
12 to 6, Monday through Saturday.
I'm sorry, can you just make sure that we've got
what are you doing?
everyone muted?
Don't miss me.
I will.
I don't really know what they wanted me, and they just let someone go like last week, and
My apologies. I think maybe one of our panelists is not muted. If we could just make sure that everyone is muted.
So like the planning stuff at the store, like retail stuff. Basically, I'm kind of an assistant.
And I'll go ahead and move on to the next kind of data point.
Yeah.
So what we were looking at was lifetime
She
initiation
bought
of
that
youth
road
vaping.
market.
And
So she's opening that restaurant too.
we also like to look at the regular use. I apologize. I really can't really move on until I have the folks muted. If my panelists can hear me, can you go ahead and mute?
The general manager's husband just started there 2 weeks ago at Jerry's in town, because Jerry's gonna be running the one that she's making.
Yes, apologize for the distraction there.
It's got a lot
I'm
going
gonna
on. It's been a lot of stuff that needs to be done. So.
go ahead and
Sorry.
great. Okay, thank you so much. Apologize for that distraction, everyone. We're going to go ahead and return to the data here. Thank you for your patience. So we looked at lifetime usage, and I wanted to point out that I'm just going to go back for a second, just because I think maybe just in case anybody didn't catch that. You'll see that the scale here is about 50%. That's for lifetime usage. So that may have been a youth who tried vaping once, stopped, decided it wasn't for them, and moved on. So what we like to look at is 30-day usage rates. And that tells us a lot more about what is the extent of regular use. So youth that are basically, maybe this has become a habit for them, or it's moved on from more than just simple experimentation. So you'll see that the scale is a little bit smaller here. We're talking about a 30% at the top, very top, and 25% is the actual use rates for 12th grade at the very top. But I just wanted to point that out. I made these charts a little bit different for readability in the webinar format, but I know from a data perspective, just wanted to make sure everyone understood that. There's one thing I want to point out about the 30-day usage rate. So in addition to the leveling off and then the small drop that we did see, one other thing that I think a lot of people had questions about when we first started measuring vaping use among youth was this whole question of Juul. And we had a question about Juul here already in the chat today. Juul was such a strong generic trademark, right? Just like tissue paper, Kleenex, it really, there were strong associations with Juul and vaping. So there was some question, hey, when we're looking at this data, and if we asked youth, have you vaped in the past 30 days? They might say no, but they might say yes to using a Juul product. So to tease that apart, in 2019, Juul usage was added as a separate question to the Monitoring the Future study. And what we found is that it really didn't impact the measures. So we had some strong confidence in that vaping question. Youth were already separating them in their minds. And the really interesting thing to me is that as researchers were able to identify that the Juul popularity was decreasing, again, as someone mentioned, because they got hit with some enforcement, what happened was rather than total vaping being reduced, youth simply moved to other brands or types of vaping rather than ceasing. So unfortunately, if Juul was your route of initiation, you may not have quit when they became a little bit less available. So now let's take a look at cannabis vaping. So you're going to see that the trends follow closely to the nicotine trends, while the overall usage is lower. Prior to 2020, we also saw those historic increases in use rates of cannabis vaping compared to nicotine vaping. But like nicotine vaping, they've leveled off. And I really just want to, again, reiterate, it's going to take a concerted public health effort, prevention effort, to help maintain that trend. And one of the reasons for that is COVID, of course. And we'll talk about how COVID may be impacting these use rates and data trends in just a minute. But again, if we're going to see the needle dropping further, we're going to need all hands on deck. And again, you're going to see that the 30-day cannabis vaping has remained fairly stable. It looks like there's a small increase in 2022, but keep in mind that this scale is smaller, so any increases are going to look a little bit bigger. But again, overall, very similar to the nicotine trends. I'm just going to mute for 1 second to take a sip. Thank you for your patience. And again, I really think it just goes to show these two substances with this method of use, nicotine and cannabis, they're so closely linked. Really, we wouldn't have been able to get to where we are with cannabis vaping if we hadn't had nicotine vaping. So let's talk about what we might be driving some of these trends. COVID, of course, is a huge asterisk on any data collection done during 2020 to 2022. Hopefully, we're starting to see that impact reduce a little bit, but it's really important when talking about data during this time period to be mindful of that. So while vaping remains a common method of use, again, we are starting to see that level off after huge increases. What I want to talk about is kind of using alcohol as a benchmark to compare where we are with vaping. So alcohol, for a long time now among youth, we've been seeing a gradual decline, and that has continued throughout COVID. So I think there's something different about vaping use rates, the trends during COVID, because it's not following, again, this gradual decline. In either case, we may have seen increased parental or guardian monitoring during COVID because a lot of youth were at home more frequently. And because they weren't leaving the home as much, they may have had decreased availability from things like social sources, or retail sources. But again, why it's so important that we strike while the iron is hot, so to speak, is because a lot of these drops that we saw, or this leveling off, is occurring during an earlier time in adolescence. And what that means is we might have a group that's more likely to abstain through young adulthood and into adulthood. So we have a chance here to really leverage some encouraging trends as long as we are mindful of those public health efforts. I also want to talk a little bit about certain populations, because as with any substances, we know that there might be additional vulnerabilities in certain populations. More youth who identify as lesbian, gay, bisexual, transgender, questioning, or queer, than youth who identify as heterosexual use vaping. It's about 13% for those who do not identify as LGBTQIA versus 18% among those who do. There's not really significant gender differences in vaping rates, but there are some that are associated with race and ethnicity, excuse me. The group that's most likely to use when you look at race or ethnicity are white non-Hispanic youth. And Black non-Hispanic youth have the lowest rates of vaping of any substance. And I only say that and point that out because when we get to our interventions, when we get to our prevention strategies, it's important to think about how you can tailor those interventions or prevention strategies to particular populations. And knowing what your data says about who is using, who's more likely to use, that's going to help you tailor those things. So data, hugely important, both for vaping, but also for all prevention strategies, for understanding where those vulnerable populations are, where to direct some of our dollars, and how to tailor our strategies. So why are these use rates concerning? Well, of course, compared to combustible tobacco, combustible cannabis, vaping is relatively new, even though it seems like it's so prevalent, and it is, but it's still new. And we have a lot of research that's still to be done. But we know a lot of things already about nicotine outcomes and cannabis outcomes, as well as some of the potential health outcomes of, again, vaping without using either of those substances. So I just want to spend a little bit of time talking about some of those potential outcomes. Where there is potential for policy intervention is around secondhand exposure. So after controlling for current smoking or vaping, there is evidence to suggest that people who are exposed to secondhand vape aerosols do experience respiratory symptoms. So even if they're not using vapes or any combustible products themselves, they are still vulnerable. So smoke-free indoor air laws are one area that can affect vaping, and in particular, the secondhand exposure outcome. States and localities, if they haven't been using it as a tool, can take a look at updating their indoor smoke-free indoor air acts to include all vaping products. And in a little bit, we'll talk about the landscape of where we're at with some of those. And you can include all vaping products regardless of whether they include tobacco or nicotine. The second vaping specific outcome I wanted to talk about was EVALI. Now, I'm sure that many of you have heard about EVALI. It was a significant news story a few years ago. We have had a little bit of concern die down as once they started to look into the cases, it was pretty clear that the most common variable was this solvent that's used to create cannabis vaping oils. And it was vitamin E acetate in particular, and in particular, some vaping products that were being sold in non-regulated markets or kind of counterfeit, or that were using the branding of other devices, but weren't actually from those companies. So since they identified that, case rates have dropped, but I think it's a really interesting case study in why we need strong regulatory oversight of vaping, and in particular cannabis vaping, in both adult use states, but also non-adult use states, right? Because again, we know that we are seeing a proliferation of products in non-adult use states that do have cannabis products in them, thanks to the the Farm Act and the hemp derived products. I just wanted to show this table. I know this isn't necessarily presentation best practice. It's a lot of numbers on this screen, and I don't like to do things like this, but I think this is just such a compelling data point about how prevalent vitamin E acetate was linked to cases of EVALI. We had 1 or 2 or maybe 3 different products that showed up once in some cases, but vitamin E acetate showed up in 94% of the cases that they identified. So it was pretty clear that that was the issue. So in case anyone still had confusion about where that was coming from, I think it's pretty compelling that that was, if not driving all of the cases, driving 95% of them, and therefore, our efforts should be tailored to that chemical in particular. So some particular cannabis outcomes that we want to be concerned about when it comes to cannabis vape. We have evidence that shows that in early adolescence, cannabis is actually a really strong predictor of poor sleep quality. Despite some perceptions that it helps me fall asleep quicker, I get better sleep. When we actually study it, it shows that it actually affects sleep quality. It makes it worse. So again, I think like with vaping, where we've seen some confusion about, is there better public health to be garnered from vaping? It's not necessarily better, it's different. It's maybe a lower risk, but that doesn't mean no risk. And again, the perception of cannabis is that it helps your sleep, when in reality, we know that from research, it's a predictor of poor sleep quality. Even more concerning is that cannabis use during middle to late adolescence is potentially associated with altered cerebral cortical development. And for a bit now, we've kind of seen that young adult age of 21 to 25 as when we start to kind of slow down in our brain development. We know now it's starting to emerge that brain development doesn't really ever stop, or it doesn't stop till much later, maybe 30s, 40s. But use during these key stages of quick development can impact how that brain development occurs. And that's concerning because that could potentially have a lot of knock-on effects. When it comes to mental health, cannabis use is linked or associated with earlier onset of psychosis symptoms, is associated with earlier episodes of schizophrenia. So there are, really concerning health effects from cannabis, and those don't go away just because you're vaping it. In fact, we'll talk about in just a second why vaping might actually be potentially exacerbating some of these health outcomes. And Nancy, I saw your question about have they stopped using vitamin E acetate as a solvent? So Again, my understanding is that most of the vitamin E acetate solvents that were still present in vaping products were present in products that were, unregulated or, potentially kind of rip-off products. So they never really saw it too much in products that were, heavily regulated or heavily tested. But that's not to say it couldn't pop up again. We're just seeing many fewer cases of EVALI thanks to some of that targeted regulatory enforcement. But that doesn't mean it can't happen again in the future. So, we want to be vigilant from a regulation standpoint to make sure that that's not coming up again in those products. The reason why vaping can potentially exacerbate these outcomes is potency. If you've attended or done some education on cannabis and marijuana in the past couple of years, you've probably heard about the changes in THC content in cannabis flower. In 1990, the average THC content of cannabis flower or the leaf was 2 to 4%. Just recently, they've done some studies of all the products advertised in adult use cannabis states, and the average concentration of THC was 21.5%. So that's a tenfold increase. And quite frankly, 21.5% is probably on the low end of percentages when it comes to vaping products. Some vape cartridges have THC percentages exceeding 90%, approaching 100% in some cases. As far as the science will let them push it, it's being pushed. This has been accelerated, didn't start with, but accelerated by legalization as we've seen investments in manufacturing processes. We did see increases in the THC percentage of cannabis flower prior to legalization as hybridization was explored. But again, because now we have all these dollars pouring into the manufacturing processes, we're now seeing products that just didn't exist really before at this high of a level, and now they're available to purchase. Dose-dependent responses are particularly concerning when it comes to things like those mental health outcomes like psychosis risk. Studies have shown an increase in the risk of acute onset psychosis that's dose-dependent. So the higher potency you use, the more likely it is that you'll have that earlier onset psychosis use. It's not just that if you use or if you don't use, it's also the strength of the product that you're using. And one of the reasons that might be driving these outcomes is that vaping, since it's a high delta-9 potency product, which is the main psychoactive ingredient, we found some others that have been synthesized now or created, but delta-9 is what we think of when we think of marijuana, delta-9 THC, is that the amount of cannabidiol, which is potentially a mitigating factor for some of those outcomes, has been kind of squeezed out of these products. So we have studies that show that CBD or cannabidiol can decrease the risk of some of these outcomes like psychosis that are caused by delta-9 and may even be suggestive of their therapeutic processes for psychosis. But again, to create these higher potency products, you kind of have to squeeze out the CBD contents. And from a marketing standpoint, it's probably easier to sell these higher potency products. So what we're seeing is less CBD content and therefore less mitigation of some of those outcomes. And again, that's another thing that is driven by a legalized, liberalized market when we don't have things like potency caps or taxation that taxes potency greater. Just a few other outcomes to discuss. Again, when we compare vaping to combustibles, we don't only have really estimates at the population level, but relatively, we do predict some lower rates of adverse youth outcomes compared to combustibles. Again, lower rates doesn't mean no rates or no risks, but why that is a little less compelling to me is that we already have seen that vaping can cause an increase in initiation of combustibles, and it can make it less likely to cease using combustibles. And again, we're seeing that decreased rate of successful tobacco cessation among youth. So even if there is, compelling public health outcomes, those are being mitigated by, kind of a poor context in which vaping is still being proliferated among youth. And again, while we had some hope that cessation might increase for pregnant people, some research does suggest that pregnant vapers are not any more likely to quit simultaneous cigarette smoking than non-vapers. So they're not substituting vaping for combustibles. They're continuing to use the combustible use in a particularly vulnerable to health outcomes time, which is pregnancy. So we obviously know from decades of research the impacts that like nicotine vaping can have on pregnancy. We're starting to understand a little bit more about how cannabis during pregnancy can cause health outcomes. And now what we're seeing is that the hope that vaping would help people quit these cigarette smoking is just not really bearing out. So what's happening is that the combustible rates are not changing among those, they're just also vaping. There's also concern about co-use of alcohol and cannabis. Cannabis and alcohol are the two most commonly co-used substances when we look at youth. And we have research that suggests that when you co-use alcohol and cannabis, there's potentially either an additive effect where when you combine them, they produce stronger outcomes than they would alone, or synergistic, where they're actually having some kind of chemical interaction that increases the negative health impact. One of those areas is driving impairment. It does seem like when you co-use alcohol and cannabis, your driving impairment is significantly more if you just use alcohol or if you just use cannabis. And of course, impaired driving, we're looking at injury prevention, we're looking at death prevention. It's a significant public health risk. Adults who vape cannabis had a higher odds associated with heavy alcohol use, which is consuming more than 14 drinks per week or more than 7 drinks per week for men and women respectively, more likely to binge drink and more likely to engage in other high-risk behaviors. So again, there's synergistic effects, there's co-use effects, and since these are the two most commonly co-used substances, we want to take a look at how our efforts can target them both individually and together. Why you're here today, you probably want to hear about, okay, we've got all these trends. It's become a really common method of use. We have these health outcomes. What can we do about it? Well, today I really want to focus on encouraging the use of a comprehensive strategy to prevent vaping use. Using something like the Strategic Prevention Framework or another environmental and comprehensive strategy is not only prevention best practice to achieve sustainable outcomes, but there is a particularly thorny issue with vaping that means that we have to make sure that we are looking at our communities as a whole and our conditions in the communities, and not just picking one strategy and going with it because it's got some compelling outcomes, but rather making sure that we understand what's going on in our communities and tackling it from a multifaceted approach. And the thing that is sticky with vaping is that we have studies that suggest that vaping restrictions, so just banning them or making it harder to purchase, may result in people who were already vaping switching back or switching for the first time to smoking combustible cigarettes or other tobacco products, which we know carry significant public health outcomes on their own. So, just throwing up a policy that restricts availability is not probably going to be effective in itself. We need to do things like education, communication strategies, and early intervention strategies to help minimize this risk. So that's just another reason why, as we take a look at prevention strategies, we want to be thinking from a strategic standpoint and thinking about all the aspects of our community, making sure that we're assessing the conditions, planning, building our capacity, and evaluating, which we'll get into all those steps in just a moment. You may be familiar with the strategic prevention framework. This is probably the most known and widely disseminated prevention strategy framework. But I'm going to use it today just to discuss along each of these steps, what are the potential things you want to think about when it comes to vaping, and encourage you to use this in your own communities as you implement any vaping prevention strategies. And we'll get into each of these steps, but you'll also notice that in the center is sustainability and cultural competence. And again, I made some of those data trends available to you around particular populations so that you can understand the importance of thinking about the actual communities that you're working with, assessing them, and tailoring your prevention strategies and interventions to make sure that you're serving those populations and their needs. As we get into the strategic prevention framework and the strategies that you can use along each of those steps, another thing I want to encourage you to do is make sure that you're involving youth in a meaningful way throughout each of these processes. It's more likely that you're going to achieve sustainable outcomes if you have youth involved who are the audience for many of these strategies. It's not just, important for ensuring that the programs that are targeting them are relevant to them, but also, again, to make sure that you have some sustainability and that you're not unintentionally affecting different areas without considering them. That youth perspective is really going to help you avoid some of those unintended consequences as you go ahead and implement prevention strategies. A couple more things before we get into the individual steps. I want you to think about community readiness as a core concept of strategic prevention work. Said another way, community readiness is really just how ready is your community to take on an issue? Are they not ready at all? Or are they so prepared that there's already successful programs in place and those programs are achieving outcomes? So we'll think about this in terms of vaping. Community readiness can be issue specific. So you might live in a community where you've had a lot of really great prevention work done around alcohol. That doesn't necessarily mean that's going to transfer to vaping. Communities can be more ready to address one issue than another, but you want to make sure that you're trying to measure it. You want to make sure that you're working with multiple sectors of the community to understand across the community, where are they? Do they feel ready to tackle this? Are they still in a state of denial? Or do they see this as a public health issue? Do they feel empowered to take on this work? It may be that your community understands the issue and does realize it's a problem, but maybe they're not yet there on how to go about implementing particular solutions. So your work in community readiness might be around building their capacity to actually implement solutions. Again, some groups of your community may be more directly affected by a particular issue, like vaping, and may be far more ready to deal with it than others. You might have other segments of the community that don't really see it as much of an issue. So you want to make sure you're working on that as well. This is an area where things can kind of quickly fall apart. If you're trying to push a strategy into a community that's not ready for it, you're not going to get a lot of buy-in or support. But if you do spend this time to work on community readiness, they may see your efforts as reasonable, logical, and achievable. And unless you've done the community readiness step, the community might not have that perception of use, that perception of it as achievable that you do, and they might not see it as successful. So it's worth investing in this step. I had a question about how do schools educate on vaping, its consequences, et cetera. So we'll get into that in just a moment as we get to the implementation step of our strategic prevention framework. That's where I'll talk about particular prevention programs, particular interventions, and one of those will be kind of that school-based education level. So great question. I think we got just yep, okay, we'll go into our first step of the strategic prevention framework, which is assessments. So when it comes to vaping, what you want to do is figure out what are the problems related to vaping in my community? What are the related behaviors? You want to start by assembling a group that includes representative of all the stakeholders. Again, for vaping, you're going to want to get youth, parents, schools. You're going to want to get your health community involved. You're going to want to get some retailers involved, policymakers, anyone that you think could potentially both be impacted by and can have an impact on this issue. And then what you want to do is work to understand your community by assessing the things that are happening there. So that can be things like, where are vaping products being sold in my community? That is a huge assessment tool to understand some of the particular problems. If they're not being sold, then how are youth obtaining them? Is it through social access? Are they ordering them online? You can probably see already how different your strategy is going to be if most of your youth are getting it from a retail store in your community versus if they are getting it from friends or ordering it from online. So again, understanding the context, but also understanding how much of a problem is this? Is vaping the largest method of use? Is it the largest substance use, cannabis vaping? That's going to help tell you how much to invest and where you can move the needle. This is also where you're going to do that community readiness step of understanding and assessing how ready your community is. Having conversations with stakeholders. Maybe it means holding a few focus groups or surveying large sectors of the community. You're also going to figure out, where are your resources? What do we have available to us to tackle this issue? Is it people resources? Is it grant funding or another funding source that will help you to pay for your program components, or potentially, pay for even your assessment or evaluation? And then also you want to think about your particular community conditions. What groups do we have that are maybe more vulnerable? Are there certain groups, again, that are using or experiencing higher levels of negative health outcomes? Have things changed over time? Is this a problem that's getting worse? Or is it a problem that seems to actually be decreasing? That's also going to help you to tailor your programs, but also when you get to your evaluation step, understanding the impact that your programs are having. And finally, you also want to make sure that you understand in your community, what are the risk and protective factors? So it might be that nationally, youth have a relatively low perceived risk of harm of vaping, but maybe that's not true in your community. Maybe the issue is really the availability, or maybe it's an issue of a perception of being seen as cool or something if they are using. Whatever it is, you're going to want to make sure that you're assessing that for your community and not just relying on larger data to help drive those. I'm going to go ahead. We are, according to my clock, at the top of the hour. So I'm going to go ahead and give us all a break. I know we've been hearing a lot from me today. I'm going to give my voice a little bit of a rest. As we take our break, we'll take about 5 minutes. So I've got 10 o'clock right now. We'll come back at, 11 o'clock. We'll come back at 11:05. For those of you who are in the central time zone with me, it'll be 10:05. But again, think about any questions you have during the break. And when we get back, we'll dive right back into our steps of the strategic prevention framework. And I'll be able to address any questions you may have sent during that time.
Thank you, Jake. All right, everyone, we will meet back at exactly 11:05.
Thank you, Rebecca.
Welcome
Okay,
back, everyone. We will begin our webinar right where we left off. Thank you all.
thank you so much, Rebecca. I hope your break was restful. You got some water, maybe stretch your legs out a bit. And we're going to go ahead and pick right off by going back into our steps to the strategic prevention framework. I did want to acknowledge the question that we received over the break from Bernadette. I appreciate that question about what can parents do to help prevention outcomes. We will talk about some resources for parents in particular later on in the webinar. So if that doesn't fully answer your question later, just go ahead and throw another question in the chat and we can further address that. And I will just kind of preview that by saying that there are some things that schools can do. Of course, school readiness is going to vary depending on where you live. But depending on what the readiness is, there's some options. And again, there are resources for parents that we will discuss. So great question, and thank you for that. And for anyone else who has some things they're wondering about, again, feel free to throw those in the chat. Part of that community readiness concept was community capacity. So this is step 2 of the strategic prevention framework. So what you want to do is work to take some small steps forward, things that help build the ability of people in your community to reach goals, things that aren't so much of a stretch to be totally beyond what they can currently do or understand, but to really help make steady process. So what you're doing here is helping to make sure that the folks involved in your prevention efforts can mobilize all of the resources that are needed to implement these strategies, whether those, again, we talked about some of like the human or people resources, possibly the organizational or institutional resources, and then of course the financial resources, and provide that training and assistance so that they can develop that skill, that knowledge to plan for and do the prevention work. You want to make sure that you're really thinking of this as a team that's made up of those stakeholders throughout your community. But when you have that team, you're also going to want to work on building that general community awareness. So to Bernadette's question, schools are often a place that people working in prevention do have some challenges getting into. And one thing you can do is work to make sure that they understand that this substance use is an issue and needs to be addressed. And oftentimes they are one of the most vital partners you can have. That's not always going to happen overnight. You're not always going to get a receptive school or a receptive community, but you're going to want to work on that progress towards building that understanding and building that capacity. Step 3 is to plan. So once you've got your prevention team, your group of stakeholders creates a plan. You want to lay out what is your goal, what are your goals, what are your objectives, and what strategies are you going to use to meet the needs of the community. You'll be working on adopting something like a logic model or other framework that's going to guide your action throughout. You're going to look at what are those strategies or what are those evidence-based best practices that seem to best fit the issues and conditions of our community. So has this been tested with groups that look like the groups in our community? Does it have the outcomes? Has it been tested to have the outcomes that we need based on the issues of our community? Do we have the resources to invest in this particular strategy? And if not, again, how can we obtain those? What are other resources that we'll need to implement the plan successfully? Once you have all that in place, then you can move on to the 4th step, which is implementation. And we're going to spend quite a bit of time on this step because once we talk about it generally, we'll look at those specific prevention strategies and interventions that might be really successful when it comes to vaping. This is where you deliver your programs and practices. You want to make sure that when you're using an evidence-based practice, you are adhering to how that program is designed and only making adaptations that help you tailor it to the specific needs or populations that you're working with. Now, I do want to caution that given the relative scarcity of data on both vaping and cannabis vaping specific prevention programs, the measured effectiveness of some of the things that we're going to talk about among all populations or among all types of individuals, with different demographic characteristics is a bit limited. Since the use rates of cannabis and cannabis vaping do vary in different communities, as we talked about earlier, some programs might require more adaptation than others to have the intended impact. So it's really important that you're being planful for these programs, understanding what are those adaptations or changes that we might need to make, and have a reason for doing so, right? We're doing this because it's going to help us reach a certain population. So think about those things as you're going forward and implementing. Once you are ready to implement, you have a range of strategies available to you. And in an ideal world, your community has the capacity to implement most, if not all, of these types of strategies. There's a really great resource available that breaks down a lot of the different types of strategies from SAMHSA, and I'll give you that information towards the end of our webinar today, but this is a product called Reducing Vaping Among Youth and Young Adults. It's where I pulled a lot of this information from. But it's going to go through these types of strategies and talk about what do we know about some of the potential effective strategies in each of these areas. There are environmental practices, and these aim to either establish or change existing policies that can help reduce, for example, youth cannabis vaping use. So these could be things like taxation strategies, prohibitions. It can be things like complete ban, or it could be something as simple as like a flavor ban. There are education programs, which again, most commonly implemented in schools, but are able to be implemented in some other settings like after school programs, community settings. Sometimes they work not directly with youth, but with parents. And they aim to increase the knowledge and skills of their participants and also influence how they feel about the substance and their actual behavior around that substance. So their actual use rates, as well as their knowledge, skills, and attitude. Because of the potential extent of youth vaping in your communities, you might also really be concerned about how do I identify the youth in my community who are already vaping and get them maybe some resources. So brief intervention or screening for high-risk individuals is another suggested prevention strategy. And basically this looks at how likely it is that this youth might develop like a use disorder or a really problematic behavior. Information dissemination is maybe what you think of as our typical media campaigns, but it helps to build awareness of both the substance use issue, but also the services that are available to help prevent some of those substance uses. And we'll take a look at some specific examples of information dissemination related to vaping in just a moment. There's also alternatives or positive behavior support that really help to try to impact that risk or protective factor. And then community-based services help enhance the ability of the community, again, to provide that prevention services. So really about that community capacity. Since I am coming from a policy perspective or policy background, I am a big believer in environmental strategies. But as with all of these strategies, it's not the only thing you should be looking at, but it is one of the most cost-effective and also one of the ways that helps best impact the conditions of your community or the context in which these substance use issues are occurring. So again, just like many of the other strategies, they are aiming to enhance protective factors. So the things that make youth less likely to use substances and reduce the risk factors or the things that make them more likely by impacting the whole community's landscape. And this can vary from legal policies, so your town's ordinances or your county ordinances, up to your state law and even federal law. But it can also be institutional policies. For example, does a school have a substance use policy? Does it include things like how to identify and refer students? Does it include things around if a student is caught on campus with the substance, what happens then? So doing this kind of work requires understanding the whole community's landscape of policy. So not only what is in your municipal laws, but what are your schools doing? What are your workplaces doing in terms of policy? And it also requires that once a policy is in place, there's both education, training, and support around that policy, but enforcement as well. And enforcement doesn't have to mean that there is a significant legal consequence associated with it. It can mean that there is a loss of privilege, or it can simply mean some education to help better understand why that person shouldn't be doing that. If it's a retailer, for example, maybe you're not taking their license away really at the first step, but maybe you're working to ensure that their employees have proper training and they have the proper signage in place, for example, around not selling to underage individuals. So it doesn't have to be necessarily a punitive thing, but it can often be an education thing, and that enforcement can help you understand that. So there were some questions earlier about state level regulations around some of these issues. One thing that I do know is that at the state level, as of the end of last year, so December of 2022, there were 33 states that had legislation that required, for example, a retail license to sell vaping products over the counter. So in other states, that might be something to take a look at is licensing. Licensing is often a powerful policy tool because, again, you don't have to give like criminal penalties. Just the threat or the potential of losing a license can often be enough to drive behavior change in retail operations. So that gives communities additional leverage if they don't have the ability necessarily or the capacity to implement other kinds of legal interventions. Some examples of particular areas where policy can be highly effective, again, because it's a relatively cost-effective way to change the conditions of your communities. There are certain things that you can take a look at in particular. One is pricing. So most commonly that's seen as something like a tax, an excise tax or a sales tax. Although sometimes communities will set minimum sale prices for certain types of products. We see this a lot in the alcohol world. So this is something that can be done, throughout all levels of government. Municipalities can also restrict where retail outlets for these kinds of products can be located within a community. They can say how close they can be to certain areas like residential areas or schools to potentially mitigate accessibility issues. They can also specify how many of these outlets can be located in a community, and they can place additional things like operating hours, signage requirements. There's a lot of work that could be done around that. Policy can also target marketing, restricting where and how products can be marketed and to whom. So for example, making sure that any advertisements aren't appealing or using any imagery that youth might find particularly engaging, because there's no reason to be marketing these products to youth. And it's illegal in many areas to sell these products to youth. And then again, you can do that point of sale policy. So if a retail store is licensed to sell some of these products, fine, but you can then further specify where can you place these products in the retail store? Do they have to be behind a counter, for example, so that a youth can't just grab it off the shelf, potentially pocket it and leave because they aren't of age? Or it's just not simply in an area where their eyes would go to entice them to purchase. they have to do that additional step of asking for it. It can also specify how the products can be advertised in store. So sometimes we see restrictions completely on any kind of promotional placement of vaping products within retail outlets. This is similar to, again, what's been done in tobacco in a lot of areas, and maybe beneficial. Again, another kind of state level look, but as of the end of last year, there's been 30 states that have passed state level legislation that requires a tax on vaping products. So again, that's another potential area. I'm just seeing a question come in. Caitlin says, can't speak for all schools, but you do go in as a guest speaker with evidence-based curriculum that talks about negative effects. Yep, we'll talk in just a minute about some of the potential evidence-based youth prevention education. So yeah, and Tamara, you're a school counselor at a middle school, and vaping is definitely surpassing fighting on our campus. It's very sad. Yeah, again, it's a widespread issue, and it's one that I think we're still working on getting tools to folks in schools and throughout the community to help impact. So again, we'll get into some school level stuff in just a few moments. The other thing I want to state, though, is that why it's really important to do things like assessment and community capacity, community readiness, is that policy work can sometimes have unintended outcomes. So I want to take taxation for just a moment. And I'm not saying one way or the other, but there's been discussion about whether increasing taxes on something like a cannabis product in, for example, Illinois, which is an adult use state, might have the unintended effect of driving sales in the illicit market. Because if you make it so expensive at the adult use or the regulated market, is that going to make people turn to an illicit market because it's simply cheaper? That's just the kind of thing you want to think about with your policies to make sure that you're not driving some unintended consequences. Anthony asked about educating peer educators at the school to address the dangers. Yeah, that's a potential, and it's a component of some of the programs that we'll talk about. And Genesis, are there preventative measures that target adults through education? That's a great question. Again, some of the programs that we'll talk about do have an adult component. Just personally, I'm focused mostly on youth, but again, as you look through some of these materials, you might find that some of these programs are also targeting adults. Certainly some of them are aimed at, again, parents or guardians and increasing their skills and knowledge around monitoring and talking to their children about some of these substances. So great questions, thank you all. And here we go, we're getting to that education strategy. So again, just to review, this focuses on the delivery of prevention services with whatever audience you're working with to increase knowledge or skills. Most often, we think of this as an education component in a school, but it could also be something that is like a parent workshop or some kind of community workshop as well. So some things to point out when you're considering evidence-based, or excuse me, when you're considering education programs, you want to make sure that you're selecting programs which are evidence-based the best. If an evidence-based program is not available to you that's targeting your particular community, or it's tested with your particular community, or targeting your particular substance of concern, then look at some things that at least are promising, right? They've got some research backing them. They don't quite have that evidence-based level yet, but at least they're informed by research and they're working towards testing it and evaluating it to get to that evidence-based outcome. The reason for that is that while education programs can be very effective, they are often some of the most resource-intensive programs that we can offer in prevention, right? You not only have to have oftentimes a facilitator who's paid to run them, or you have to take time out of the school day. You also have to pay for materials sometimes, some programs, or pay for evaluation. And it takes a lot of time, right? Because you have to have somebody working like in a classroom, one-on-one in person. Many of these evidence-based programs have several weeks to them, which require full class periods or full hours. They have minimum time requirements to meet their outcomes. So they're very resource intensive. So that's just why you want to make sure that any program that you're implementing as an education program, you can be relatively confident, because it's evidence-based or evidence-informed, that it's going to get you towards the outcomes that you're looking for. And you're not just wasting resources on programs that might not actually have any proven outcomes. Again, that you want to make sure that whatever population you're working with, that the program you select has actually been tested with that population in a similar setting. So if it's an after-school program, you want to make sure that it's been tested in an after-school setting and not just in an academic class setting. Do be mindful of outcomes. I think because vaping is relatively new in terms of substances, it does take a while for evaluation and research data to catch up. So it may be that there's several programs out there that are very strong and have strong outcomes for many substances, but they haven't yet achieved that research base for vaping prevention. Some of them have, though, so you want to make sure that vaping is in particular listed in the outcomes of that particular program. There are some that I'm aware of, and again, some of these do have adult components. Some of them do have peer educator components. Catch My Breath is one program. This is Quitting. And again, some of these will be in the resources towards the end of our webinar. This is Quitting in particular is great for resources for particular community segments. They have additional resources if you're working with LGBTQIA populations. Catch My Breath, I know, has Spanish versions of their resources available. So again, it's really important to know what those populations are that you're implementing with and what those interventions are that are available for those populations. And then some other evidence-based youth prevention education programs that don't focus entirely on vaping, like Catch My Breath or This Is Quitting or Smokescreen. Those are mostly focused on vaping or combustibles. But they do have cannabis and vaping components, are things like Too Good for Drugs, Botfin's life skills programs. So again, they weren't necessarily developed particularly for vaping, but they do have some of those components to them and may get to some of those outcomes. And then just another thing I want to encourage is, again, because education programs are pretty costly and resource intensive, you want to make sure that they're implemented as part of your wider comprehensive strategy, right? Because if you're in a classroom working on some of these skills and knowledge, that means that there's parts of the community that you might not be reaching, right? You might not be reaching parents. You might not be reaching policymakers. So you want to make sure that you're still focusing on those strategies as well to help make sure that the conditions of the community are conducive to having those outcomes in the education program sustained throughout. And Kylie shared that Prevention Plus Wellness is another program that they're aware of that has a vaping component. So thank you very much, Kylie, for sharing that as well. I've also seen some information come in from Stephen and David about hidden in plain sight. So my understanding about hidden in plain sight is this is a parental or guardian education program to help them identify, where in the home, or just kind of identify the signs of substance use, wherever the kids might be hiding items, as David put it, and it's been successful. So yeah, great programs. I think those are also good illustrations of, parental education is important, but you also want to make sure that you're helping the parents out by looking at things like the availability of vapes in the community, right? So it's okay if you are obviously teaching parents how to identify these, but let's help them out too by making sure that once they can identify them, it's also harder for youth to get them, right? So it's less of the burden on the parents as well. Nancy asked if there's any youth peer prevention programs specific to vaping. Nancy, I'm not sure about that. So at the end of the webinar, please take my email address down, send me an email. I'll look into that for you and get you an answer as soon as I can about peer prevention programs specific to youth vaping. Great question. I do know that there are some that have components of peer-to-peer, but I'm not sure about like a focus on peer-to-peer. So I'll get that information to you if you connect with me after the webinar. great question. Another important component of doing prevention strategically is having a process for identification and referral, right? So we know that some youth may have had some exposure or some experimentation, some usage of vaping products. So we want to make sure that we have programs in place to screen for that and refer those students to additional help. And this would come before like the level of a full clinical assessment. This is really just that first initial use. So if you're working in prevention, one thing I absolutely encourage you to do is make sure you have researched and understand the landscape of referral sources where intervention, where you can send any referrals when intervention might be indicated for some of those students as well. A few things that have come into the chat. Hillary shared that SAD has elements of peer-to-peer led organizations. Thank you, Hillary, I appreciate that. I'm getting some information from some other folks that are interested. And then Meredith shared that in your state of Florida, you have SWAT clubs in each of the 67 counties, and that stands for Students Working Against Tobacco. So thank you for sharing that, Meredith. I'd be really interested to see if that SWAT program has an evidence base, for example, and if maybe some of their outcomes would be also applicable to cannabis or marijuana, if some of that evaluation is being done. So I'll look into that as well, but thank you so much for sharing that. When it comes to identification and referral, and this hidden in plain sight is a nice dovetail to this, but vapes carry this additional kind of confounding variable, right, of concealability. School districts, parents are often confronted with, how do I even recognize when it happens? Because many of these devices are easy to conceal. They do things to kind of mask what we would think of as the traditional scent of cannabis, for example. So what do we do? Well, I know that one thing some schools have turned to is vaping detection devices. And, I have seen some evidence that they work really well in terms of actually doing the identification. So, some schools have gone ahead and put them in restrooms, for example. But what I haven't seen is evaluation of them as a prevention tool. So does having them in the school actually have outcomes on the rate of youth vaping? Or is it simply shifting the problem? I just don't know. So I just wanted to bring that up because I know that it is often a question and there's a high level of interest in it. And so I think I would be doing a disservice if we didn't discuss it. But just note that, to my knowledge, detection devices don't have the same sort of evidence base that something like a youth prevention education component might have. So it's probably not the first or only place to invest resources. You're going to want to look at some of the other conditions of your community and contributing factors before you, I think, rush into something like a vaping detection device. They are pretty expensive. So, and Lisa just clarified for the funding for SWAT, doesn't allow for all middle school or high school. So there's some resources to consider there, but maybe a good starting source for starting resource that Janet pointed out. So thank you very much for that conversation. It's always really encouraging to see that conversation happen when you are presenting a webinar like that. Again, while we're on that identification and referral piece, I do want to spend a little bit of time talking about alternatives to suspension. I think for many decades, enforcement of some substance use policies relied on taking students out of school. We've learned since that students who are suspended or expelled for some of these violations, we're actually not doing them any service. They actually become more likely to use substances. They have worse educational outcomes. And it doesn't really have a big effect on the actual issue that we're trying to address, which is substance use. So instead of suspending or expelling or removing the student from school in some capacity, you want to instead focus on those other prevention strategies, right? Communication campaigns that focus on abstinence messages or focus on no use messages, enforcing some non-use policies that aren't removing the student from the school. Maybe there's some other kind of things like referral to an intervention service. And then using more of a remedial approach to policy evaluations rather than use of suspensions. Here in Illinois, I know that our State Board of Education has come out and instructed, if not highly suggested, school districts not to, for example, like refer student caught on campus violations of substance use policy violations to like, a law enforcement or necessarily like that. So Kate asked, what kind of consequences are there for schools without using suspension? It's been an issue at your son's school. So very good question, Kate. Again, I do encourage you to take my email address down because I can send you some particular resources for alternatives to suspension. But you want to do, some other things that remove privileges, maybe, or at least have some support programs. So, it might be something like enrolling them in an education component, a small group component, where it's targeting the use and not working on something that might actually have some unintended outcomes. But yes, Kate, absolutely. I will send you some particular resources on that if you get in touch with me. David just shared a little bit about their experience using detection devices. There is a delay in letting someone know that it occurred. Yeah, the person's gone. So if you rely on camera, but that only works if there's a student in the bathroom, if a large number, it ends up being pointless and many were ripped off. So yeah, David, you're definitely illustrating some of the issues that might occur with some of those. So again, I think it's kind of a shiny new product, but it remains to be seen if it's really effective. So Abby, in your county, you suspend students for 5 days in addition to attending our 8-week prevention program. So yeah, I think from research, that 8-week prevention program is probably what's going to have the outcomes, and the suspension might not. So that might be something to look at. And again, you're going to want to use their whole, your whole strategic prevention framework of looking at your data and looking at potential policies that might impact that usage rate. But again, alternatives to suspension, I highly, highly recommend looking at that. Lisa, my email address will be up at the end of the presentation, but I'll also type it into the chat in just a moment. So thank you. And Mrs. Levinson provided some information on some Florida-based, it sounds like Florida-based intervention programs as well. So again, thank you all. Fantastic conversation. I'm just gonna move on to just a little bit. And someone pointed out, yeah, in-school suspensions, not outside school suspensions. Yeah, there are some differences there, but yeah, generally you're gonna wanna avoid removing the students from the school. Some of the information dissemination campaigns that are out there, just wanted to share some examples that I think are really strong. The Food and Drug Administration, which again is in charge of regulating vaping products, has a campaign called The Real Cost. Focuses on both e-cigarettes and combustible tobacco products. A lot of it is applicable to cannabis vaping as well. Their campaign materials are available in English and in Spanish. So it's a campaign that I encourage you to check out. You can use some of their materials in your own communities. The National Highway Traffic Safety Administration has a campaign that I think is a really interesting example about what we're dealing with when it comes to low risk of harm perceptions associated with cannabis use. They have If You Feel Different, You Drive Different campaign, which focuses on cannabis impaired driving. Of course, just like with other health outcomes, there is a lower perceived risk of harm when it comes to cannabis impaired driving. So this campaign aims to target that perception in particular, that, hey, you don't need to be, drunk or feel really high for you to already have some impairment. If there's any sort of difference, you're most likely not going to be able to drive as well as you would if you were not impaired under other substance. So just avoid it entirely if you can. So if you can communicate that risk of harm, I think that's a really interesting way of doing that. So those are just some examples. Again, I'll share a few more in the resources section just as we get towards our wrap up in just a few minutes here, actually. Okay, so we've worked through the 4 steps of the strategic prevention framework, the first 4. We spent a lot of time on implementation because I wanted to share with you some of those interventions that have some evidence base behind them for achieving outcomes with youth cannabis vaping use. But I want to turn back now to the last step of the strategic prevention framework, and something I think is maybe sometimes overlooked, but is really crucial, and that is evaluation. So now you're looking at, when you implemented your program, what kind of outcomes did you have? So that's one type of evaluation. And then the other type of evaluation, you want to take a look at the process. So how did it actually look to implement some of these programs? So that can be things like, did we reach the number of people that we planned to reach? Did we carry out what we planned to do in the way we had planned to do it? And in the time period we had planned. Again, if you're doing like a youth prevention education program, for example, you want to make sure that you are implementing all of the sessions and in the time frame that's specified, because that's how the program was tested. So if you're not doing that, then you're not necessarily going to have the outcomes that you intended. If you were running a communication campaign, did you disseminate all the messages that you intended to? Where did you put those messages up? Were they in places where people could see them? And what was your total reach? How many people saw your campaign? You also want to collect, feedback about the design and what might need improvement for some of your messages. So that's all part of evaluating the process of your program. But when it comes to the outcomes that you're having, you want to make sure that you're considering whether your program had your intended effect on the things that you wanted to change. So whether that was the risk or protective factors. Did you have an impact on the perceived risk of harm of vaping? Did you make it more difficult for youth to access cannabis vapes? If you didn't, you want to look at why that is. Is this program not a good fit? Maybe we overlooked something when we were selecting our program. Or maybe it was something about the way we implemented it. Did we not use all the core components? Did we make too many changes? Ultimately, what we're trying to do with all of these prevention programs is delay youth usage or create, complete abstainment from vaping. So if we're not getting to those 2 outcomes, we have to look at what it is that we need to change for next time to make sure that these programs are effective. And evaluation isn't just done once. You want to make sure you're doing it throughout the process, that process evaluation. And then once you begin your cycle again, you want to evaluate your outcomes at the end of that additional cycle. We're getting towards the end of our time today, so I want to make sure we spend a little bit talking about some of our key takeaways that I would like you to consider. And then I'll spend some time as well sharing some of those resources that I discussed with all of you. So again, I just want to emphasize that it's really vaping's meteoric rise to one of the most prevalent forms of use for both nicotine and cannabis among youth that's making some of these things really tricky. It's going to take time for research to catch up in terms of what are the most effective ways to affect change in vaping rates. But in the meantime, if we're being strategic, we're involving stakeholders, we're doing assessment to understand the conditions of our community, we can better employ what we already know, again, to help enhance those protective factors and reduce the risk factors of youth use. Keep in mind that while we did have really significant rises a few years ago, growth is leveling. So we want to build off of that trend and implement these strategies now so that we can make sure that these cohorts, as they grow up, are not increasing their use rates. Keep in mind, again, that certain populations are more vulnerable to use. So as you consider your programs, look at the data about those demographics in your community and make sure you're paying attention to the programs that can either impact them or that you can tailor to impact them. We want to make sure we're always conveying the message that while vaping might not have the same public health concerns as combustible cannabis or combustible tobacco, it still carries risks, and these risks are significant. Again, as you're implementing strategies, be strategic. Think about your environment. Think about the ways that you can impact things effectively and change the conditions of your community. Think about those policies. Think about the way that youth access and assess the way that youth access vaping, cannabis vaping products. And think about how these products are being marketed in your communities and what things you can do to change that. And then, of course, involve youth at steps of the process. So consider youth one of your stakeholders. These programs are more likely to be successful when you're meaningfully engaging youth throughout all of the process. I'm going to suggest some particular resources. Of course, I also encourage you to do your own research and find the things that may be more applicable to your community, to your needs. But here's some things that I think could be really handy for you. The Substance Abuse and Mental Health Services Administration operates prevention technology and transfer centers throughout the country. These are regional centers. So there's one in the southeast portion of the country that's really focuses on serving that region of the country. And they have really strong webinars, trainings, resources, and toolkits as well. So you'll find a link for that in the PowerPoint. At SAMHSA's federal level, they have a great parent resource called the Talk They Hear You campaign, which encourages a more robust conversation and gives parents some additional skills to help build their ability and confidence in talking to their youth about substance use. And vaping is one of the things that is covered. They also have the Evidence-Based Practices Resource Center, and they publish products to help people in the field understand state-of-the-art science. What are the things that they might be able to utilize within their communities? It's one of the things that I utilized heavily for creating this webinar as well. Again, I mentioned some of these national campaigns earlier. This is Quitting, for example, but thetruth.com also has a lot of great resources and media available. Lung.org, another great resource for going to accessing materials, utilizing messages that have been created for you. And also, again, for your own kind of, for your own professional development or your own personal knowledge, enhancing your own personal knowledge. I think these are all great resources. Lisa, you shared about Don't Be a Lab Rat. Could you elaborate on that? I don't know if I'm quite familiar with that campaign. If there's a little bit more information you could share in the chat with all of us, I think we'd all benefit from that. So thank you. There's also the Tobacco Education Resource Library, and thank you, Lisa, for adding a link. Again, this is another resource for talking with youth or talking with students. It's aimed towards educators. I think some of it can be applicable to parents as well, but if you're looking to enhance the capacity of school folks or other kinds of educators, that's a great resource there. The Vaping Prevention Resource hosts many media and policy resources, which I think are great for, again, if you're working on some of those environmental change strategies, some of those things can be really, really helpful for you. And then Stanford has a great program called the REACH program. And I've attended their conference in the past and found it really, really helpful. It's relatively affordable and they do it virtually, so it's accessible from anywhere. But they also host cannabis education resources that are aimed at school-age youth and have vaping specific ones as well. So I encourage you to seek those out. I'm going to go ahead and put my thank you slide up, but that doesn't mean we're done yet. We have some time for questions. I just wanted to get our website up there. I'm going to go ahead and type my email address into the chat right now. And then after we have a little bit of time for additional questions, there is also at the end of your PowerPoint, you'll find all the references that I used in developing this presentation. I think that you can do a lot deeper dive on some of this information there. And a lot of it is firsthand research. So if you're like me and you're really interested in stuff like that, definitely check out the end of that PowerPoint. So again, thank you. I'll stop now for questions. Thank you,
Thank you
Lee.
so much. Thank you so much, Jake. I don't see any. We'll give everyone just a few more seconds. Mostly I see people thanking you for a great job, and it really was a great webinar. So I just want you to know that.
All right, thank you. And Lisa put that a link in the chat for that Don't Be a Lab Rat if you'd like to check that out as well. Well, since I'm not seeing any additional questions, I'll turn it back over to Rebecca for our wrap up.
All right, great. Well, thank you so much, Jake. We really appreciate all the work you put into this. Everyone, we have shared Jake's information right here on the screen. Any further questions, you can reach out to him and ask him directly. Any further questions? Thank you again so much. It was an absolutely wonderful webinar, and you were great and very engaging.
Thank you so much.
Of course. So before we conclude today's webinar, we have a little bit of information that I'd like to share with you before we end. You'll be prompted to register or sign in to complete the evaluation. You can register as a visitor at no cost. For CEs to be reported to CE broker for Florida licensed healthcare practitioners, you must have provided an accurate Florida Department of Health license prefix and number when you registered for this webinar. After you register or sign in, you'll be directed onward to the evaluation. You must use the same email address you used when you registered for our webinars and when you set it up in your FATA profile. This is the only way to connect your attendance and your profile. After you register or sign in, you'll be directed onward to the webinar and to the evaluation for this webinar, and then you will get a second opportunity to complete the evaluation through a follow-up email later today. The evaluation will close midnight, Monday, May 29th. We do not email statements of credit. Instead, after we verify attendance and completion of the evaluation, a statement of credit will be generated as a journal entry within your FATA profile 30 business days after the evaluation closes. Thank you all so much for participating in today's webinar. We'd also like to recognize and especially thank the Florida Department of Children and Families, Office of Substance Abuse and Mental Health for funding today's education. I hope you all have a great rest of your day. Please see in the chat panel, we've been posting the PowerPoint throughout the chat. So if you're having questions about looking for a copy of the PowerPoint, it is in the chat. Additionally, a link to today's evaluation is also in the chat for you, and you should get that second follow-up email. Thank you all. I hope you have a great day.